Since the end of 2019, the world has witnessed a spectacular outbreak of infectious disease that spread inexorably through all continents. The COVID-19 pandemic has triggered an unprecedented chain reaction of restrictions to border crossings throughout the globe. Border agencies must be prepared for this kind of emergency and anticipate how related risks can be reasonably contained at borders. In the next few minutes, you'll learn how to protect yourself and others while continuing to perform your tasks, mission and duties. COVID-19 spreads easily when in contact with others who are infected, via droplets in the air, via physical contact between people, such as shaking hands and by touching contaminated surfaces. COVID-19 symptoms typically appear 2 to 14 days after someone has been exposed to the virus. COVID-19 symptoms may include fever, shortness of breath, a dry cough, and tiredness. As a border professional, adopting personal protective measures can help prevent infection. Always wear adequate personal protective equipment, such as mask and gloves. Use a FFP2 type or similar standard mask, or if possible, a KN95. Clean your hands for at least 25 seconds with soap and water. Avoid touching your mouth, nose and eyes. Disinfect your workspace on a regular basis using suitable products. Making changes to the organization of border crossing points helps to prevent the spread of infection as well as identify sick travelers. Have protective equipment in place to protect yourself and travelers on the border, including FFP2 or KN95 type masks and gloves for your personal use, and disposable masks for travelers. Place disinfection products like water, soap, alcoholic hand rub and sprays throughout the BCP. Reorganize the flow of passengers to prevent large gatherings and further spread of infection by introducing additional lanes for passengers. Consider directing arrivals from places of origin presenting a higher risk to specific dedicated corridors, or introduce other measures to maintain social distancing of at least 1.5 meters between people. Introduce dedicated screening and contact tracing measures into border control procedures to help identify possible COVID-19 cases. At the first or primary screening point of the BCP, dedicated staff should make an initial assessment of passengers for signs of infectious disease. This may include measuring a passenger's body temperature and administering self-reporting questionnaires for symptoms or potential exposure to infection. If signs of illness are detected, the travellers should be isolated and referred to a secondary screening conducted by medically trained professionals. At the secondary screening point for passengers showing signs of infection, measures include in-depth interviews with ill travellers to determine symptoms and exposure to the virus, medical and laboratory testing and contact tracing of incoming travellers. Make sure that possibly infected persons are isolated in separate rooms or tents and carry out contact tracing immediately to screen and potentially isolate passengers from the same flight, boat or vehicle as confirmed infected people. After your shift, there are additional measures you may take to protect yourself, your family, friends and colleagues from the risk of infection. Clean or decontaminate your work equipment, including shoes, avoiding the spread of particles and dust. Take off duty clothes and wash them with laundry soap as soon as possible. Take a shower or wash exposed skin with soap and water. Self-monitor for signs of illness and remember to always seek medical advice if you show any symptoms. These guidelines were developed based on international good practice and World Health Organization recommendations. All measures taken by national authorities should be in conformity with the applicable national legislation and regulations and international obligations.